In a few moments, but first, the three things you need to know right now about the coronavirus. A heartbreaking milestone this morning. 10,000 people have died in the U.S. That's more fatalities than 6 wars combined. President Trump saying there is light at the end of the tunnel when it comes to a vaccine and treatment research. He says 10 different therapeutic agents are in active trials, and some are looking incredibly successful. But the FDA says they still have to go through a process. And China reporting good news. The country did not have any deaths yesterday and reports 32 new cases. Now to the latest on the coronavirus pandemic in Georgia. The state health department says nearly 300 Georgians have died, with more than 7,500 confirmed cases. And a new model showing coronavirus activity reaching a higher peak and sooner than expected. Projections showing deaths hitting an all-time high, more than 130 in just one day alone in our state. Nick Sturdivant live in Atlanta for us this morning. And Nick, we're 2 weeks away now from that projected date. It's now April 21st.
Yeah, that's right, Sheba. Good morning. And that model essentially bumping up the timeline for Georgia by 2 days. The Institute for Health Metrics and Evaluation updated its metrics on Sunday. And here in Georgia, updated data lists the projected peak for hospital activity comes on April 20th. The IHME has increased its estimate for the death toll in Georgia. Late last month, the model predicted more than 2,700 total deaths by early August. The latest models have now increased the projected overall death toll to more than 3,400.
Models are changing all the time because as more accurate data is coming, you keep on changing the models, right? And I think that's just a reality of modeling.
And Sheba, IHME Director Christopher Murray called social distancing very crucial at this point. And look, they're basing these models assuming that we keep this in place by the end of May.
If this could happen to a big, strong hamburger like Bryce, it can happen to anyone.
A mother's heartbreaking message after losing her son to COVID-19. The 31-year-old former football player was otherwise healthy when he lost his fight. Christy Diaz practicing social distancing from her home in Fulton County. Christy, his mom is now using his death to help prevent others.
But this one really tugs at your heart. Bryce was perfectly healthy until he started feeling sick in mid-March. 8 hours later, he was in a medically induced coma in the hospital. Of course, his family rushed to go be with him, but because of visitation restrictions, they weren't allowed inside. His mom says Bryce poured his soul into working out and staying healthy, but somehow this virus caught hold of him. Doctors say it ravaged his heart, causing 2 heart attacks. He did not survive the second one. Now, his mom, who had flown into Atlanta to be with him, was unable to see him until he had died.
Before he passed, the doctor did put the phone up to his ear, and we were able to let him know how much we loved him and how much we missed him.
Now, this mother who is mourning and grieving her son is now also thinking about the person who spread the virus to him, wondering if that person is doing okay, and maybe also wondering that if they had known this virus would kill her son, maybe they would have stayed home. Sheba.
All right, Christy, thank you. Just terrible. The U.S. death toll in the fight against COVID-19 has surpassed 10,000 now. Confirmed cases reaching more than 330,000. And according to a new health department inspector general's report, hospitals are facing dire shortages of medical supplies. This includes everything from thermometers and testing kits. Tracy Potts has more from Washington, D.C. on the response from the Trump administration.
The states seem to be very happy. Most of the critical needs are being more than met.
But a new health department inspector general's report of 300 hospitals shows their #1 concern is a critical shortage of supplies, including test kits. President Trump says that's not entirely Washington's problem.
States can do their own testing. States are supposed to be doing testing. Hospitals are supposed to be doing testing. Do you understand that? We're the federal government. Listen to me. We're the federal government. We're not supposed to stand on street corners doing testing.
We are nowhere near the level of testing that we need to get.
With nearly 2 million coronavirus tests done so far, the nation's death rate is climbing. now topping 10,000. New York is seeing a slowdown, but the nation's top infectious disease expert questions whether normal will ever look the same.
If you want to get to pre-coronavirus, that might not ever happen in the sense of the fact that the threat is there.
President Trump says he's open to working with Democrats on a second stimulus to help the economy.
We know already that the acceleration of the pace of this virus and this assault, not only on the lives but the livelihood of American people, that we must do more.
That, the president says, could include a second round of direct payments to Americans struggling to make ends meet.
And so the big question so many people have, when will this all end? President Trump not really answering the question yet about whether social distancing will be lifted at the end of the month. Tracy Potts, NBC News.
Turning to developments overseas right now, UK Prime Minister Boris Johnson in the intensive care unit after testing positive for coronavirus. The Prime Minister admitted to the hospital on Sunday after his condition worsened. Liza Lucas reporting from her home in Fulton County. Liza, what's the latest on his condition?
Well, we know that he remains in intensive care this morning. The Prime Minister's last official update came from his office, and it was that he was conscious and did not need to be put immediately on a ventilator. But I am seeing reports this morning that he has received oxygen support. Now, Johnson was taken to St. Thomas Hospital in London late Sunday after experiencing a persistent high temperature. He was diagnosed with COVID-19 10 days ago. The 55-year-old is the world's first known head of government to fall ill with the virus, and Foreign Secretary Dominic Raab is set to take over for him if he should become incapacitated. And we've seen the headlines splashed across social media this morning, the front pages that are spotlighting his condition and keeping everyone posted with the very latest from Britain as the well wishes continue to come in from leaders across the globe. And I've also seen a movement of a Clap for Boris campaign that's set to happen at 8 o'clock tonight, of course, UK time. They're planning to get out there, do a round of applause for the Prime Minister and show support. As always, we're going to keep you posted on the very latest on his condition on air as well as online.